This video is intended to help support training of the vessel mapping procedure for the creation of a WavelinQ endovascular AV fistula. Vessel mapping is an important step in identifying patients who can successfully receive an EndoAVF. Sonographers play a vital role in this process by accurately screening and communicating results to the physician to determine which patients are potential candidates. This video will walk through the necessary anatomy and measurements required when vessel mapping for the EndoAVF creation. The WavelinQ 4 French EndoAVF system is designed to give patients a versatile endovascular AV fistula creation alternative to open surgery. Using two thin, flexible, magnetic catheters and a burst of radiofrequency or RF energy, physicians can create an endovascular AV fistula. In order to create the EndoAVF, the physician inserts two thin, flexible magnetic catheters into an artery and a vein through a small puncture or incision. When placed in proximity, the magnets in each catheter attract to each other, pulling the vessels together and align the RF electrode. The venous catheter, which contains the electrode, delivers a burst of radiofrequency energy to create a connection between the artery and the vein. Then the catheters are removed. A brachial vein embolization is then recommended to divert more flow through the superficial veins, cephalic, median cubital, and/or basilic veins for dialysis. Benefits of the WavelinQ EndoAVF procedure include avoiding surgical scarring and minimizing arm disfigurement generally associated with the fistula created with open surgery. Prior to the WavelinQ procedure, patients are evaluated to determine if they are a candidate for an EndoAVF through vessel mapping. Who is a candidate for the WavelinQ EndoAVF? Patients considered healthy enough to have a standard endovascular procedure and a surgical AV fistula qualify for further assessment. Standard AVF screening includes checking for good inflow with the brachial artery being at least 2 millimeters in diameter and identifying good outflow with either the basilic superficial or superficial cephalic vein measuring 2.5 millimeters in diameter or greater and without a flow-limiting central venous stenosis. In addition to the standard AVF screening, a WavelinQ EndoAVF screening has 3 additional steps. First, the candidate must have vessels that can accommodate the device, which means procedural access vessels must be 2 millimeters or greater in diameter. Second, the WavelinQ EndoAVF candidate must have a perforator that is greater than or equal to 2 millimeters in diameter, which is how the superficial and deep veins communicate. And finally, to be a candidate for WavelinQ, the patient must have an adequate creation site with ulnar artery and vein and/or radial artery and vein greater than or equal to 2 millimeters in diameter. While WavelinQ EndoAVF creation is helping to establish more anatomical options for fistula creation and provide an option outside of surgery, those who do not have a perforator or have known central venous stenosis or upper extremity venous occlusion on the same side as the planned AVF creation are not candidates. Also, the procedure is contraindicated for patients with target vessels less than 2 millimeters in diameter. Prior to vessel mapping, make sure you have placed a tourniquet on the patient's arm. Start vessel mapping by checking the venous outflow. Assess and measure the superficial cephalic vein, measuring proximal, mid, and distal locations in the upper arm. During this time, check for flow-limiting central venous stenosis. Then repeat this screening for the basilic vein. In order for the patient to qualify for a WavelinQ EndoAVF, either the cephalic and/or basilic vein must be at least 2.5 millimeters in diameter. In this case, we see the candidate's cephalic vein is 2.7 millimeters in diameter, and the basilic vein is 4.7 millimeters in diameter. So they do meet the initial requirements, and we can continue screening the patient to see if they are a candidate. If the patient does not have either a cephalic or basilic vein, measuring at least 2.5 millimeters in diameter. The patient does not meet the minimum requirements and is not a candidate. After confirming the patient has adequate venous outflow, cephalic or basilic vein greater than or equal to 2.5 millimeters in diameter, the next step is to confirm the patient has a perforator. Follow the cephalic or basilic vein down to the proximal forearm. You will see the perforator dive down from the cephalic or basilic vein as it meets the median cubital. This is where there is communication between the deep veins to the superficial veins. While observing the perforator, it is important to measure the perforator in the longitudinal view, as it must be at least 2 millimeters in diameter and cannot be tortuous. If you confirm the patient has a perforator and that it is at least 2 millimeters in diameter, you can continue screening the patient to identify if they are a WavelinQ EndoAVF candidate. In this case, we can quickly identify the patient has a perforator, that it is straight and communicating from the deep system to the superficial system. We measure the perforator and it is 3.1 millimeters in diameter, so we can continue screening this patient to determine if they are a candidate. In this case, we see that the candidate does have a perforator, but it has a C-shaped curve to it. This perforator is considered tortuous, and the patient would not be considered an ideal candidate. Make note of the tortuosity and discuss with the physician. In some cases, as you follow the cephalic or basilic vein down to the proximal forearm, you may not see a perforator communicating from the superficial system to the deep system. If a perforator is not present, this patient would not be a candidate for the WavelinQ EndoAVF procedure. It is important to note for the physician the flow dominance. At the proximal forearm where you have identified the perforator, rotate your probe to the long axis to determine if the candidate has a cephalic dominant outflow as shown here or basilic dominant outflow as shown here. Flow will predominantly travel to the larger outflow vein and in line with the perforator configuration. Assess arterial inflow just above the elbow crease. Place the probe to locate the brachial artery and measure. The brachial artery must measure at least 2 millimeters in diameter for the patient to be a candidate. Only the brachial artery should be used for arterial access. At the same time, measure the paired brachial veins, as these can be potential access points for the device for the physician. In this patient, we see the brachial artery is 3.1 millimeters in diameter. The lateral brachial vein is 2.5 millimeters in diameter, and the medial brachial vein is 1.4 millimeters in diameter. If the patient has a brachial artery greater than or equal to 2 millimeters in diameter, you can continue screening. If not, they do not qualify for the WavelinQ EndoAVF procedure. In order for the patient to be a candidate, they need to have adequately sized veins and arteries at the intended creation site. First, the radial assessment should be taken immediately after the perforator and not too distal down the arm. Measure the radial artery and paired radial veins. Also check for triphasic flow and calcium, as the device cannot create the AVF through calcified vessels. Next, assess the common ulnar trunk, which is typically after the radial takeoff, but before the interosseous takeoff. The transition of the common ulnar to the interosseous vessels looks like this. The stacked ulnar vein, artery, and vein will change obvious orientation from an angle or vertical stack to horizontal or flat. This is the interosseous takeoff. You will need to move more proximal to take the measurement of the ulnar artery and ulnar veins. After taking the measurement of the ulnar artery and ulnar veins, check for triphasic flow and calcium. In order for the patient to meet the requirement and to continue the EndoAVF screening, they must have a radial artery and at least one radial vein be greater than or equal to 2 millimeters in diameter, or the ulnar artery and at least one ulnar vein greater than or equal to 2 millimeters in diameter. For arterial access, only the brachial artery should be assessed. Earlier in the screening process, we would have determined that the brachial artery is greater than or equal to 2 millimeters in diameter to accommodate the device and have sufficient inflow. For venous access, there are multiple options. It's important to note the size of the brachial veins just above the elbow crease for potential access points. We will also need to measure the radial and ulnar veins within a 3-inch window from the wrist. One of the veins measured, upper arm brachial or ulnar or radial at the wrist, must be greater than or equal to 2 millimeters in diameter to accommodate the device, and the physician will decide which option is best for access. At this point in the vessel mapping screening, if the candidate has an access vein greater than or equal to 2 millimeters in diameter, they would be a candidate for the WavelinQ procedure. One of the main factors that help to ensure the WavelinQ EndoAVF procedure is successful is by identifying the right patients. In order to correctly identify patients who qualify for the procedure and will have successful outcomes, vessel mapping needs to be done prior to the procedure. If the patient is considered healthy enough to have a standard endovascular procedure and an AV fistula, utilize the patient selection flowchart to confirm if a patient is a candidate for WavelinQ. Is there a usable cephalic and/or basilic vein for fistula outflow greater than or equal to 2.5 millimeters in diameter? Confirm the presence of a patent perforator in the proximal forearm. Ulnar or radial artery and ulnar or radial vein greater than or equal to 2 millimeters in diameter. Assess brachial artery diameter. It must be greater than or equal to 2 millimeters in diameter to accommodate the device. And at least one vein, brachial, ulnar, or radial, greater than or equal to 2 millimeters in diameter. If you have further questions, please contact your local BDPI representative. After the WavelinQ procedure, the physician will typically schedule a follow-up anywhere from 2 to 6 weeks post-procedure. Recommendations for vessel mapping protocol post-fistula creation include measuring the brachial artery flow rate, which should be greater than or equal to 500 milliliters a minute. Then determine which superficial outflow vein is dominant, cephalic or basilic vein. That vein should measure at least 4 millimeters in diameter. A brachial artery flow rate of greater than or equal to 500 milliliters per minute and a superficial outflow vein of at least 4 millimeters in diameter is considered matured sufficiently to begin dialysis.